everyone. Thank you very much for joining us today. I'm Deborah Garlick from Henpicked and Henpicked Menopause in the Workplace and author of the book Menopause, The Change for the Better. This session is all about menopause and getting a good night's sleep. And I know whenever we're doing training in workplaces, that is one of the number one symptoms of menopause. And I'm particularly excited to introduce Dr. Justine Setchell and Dr. Jessica Barron, because they've got so much to say on this subject, and I'm pretty sure that they're going to be helping you understand what it is that you can do during this time. How can you get that good night's sleep? So Dr. Setchell and Dr. Barron, can you join me, please?
Yeah.
Thank you. And I've got to say, the first question has got to be, why is sleep so elusive during this time?
Well, there are many things that alter your sleep when you're menopausal. I think the first one, very obviously, is hormones. At the time of the perimenopause, your hormones go up and down, and it's this hormonal imbalance. The fact that the ovaries aren't producing estrogen so consistently that in itself causes sleep to elude you when you feel you most need it. The other thing is, of course, what else is going on in your general health. If you're perimenopausal, your hot flushes and your night sweats, which wake you up. If you suffer from anxiety and depression, that can play a part too. Other physical things such as heartburn, pain from arthritis, needing to get up and pee more often, even people who suffer from restless legs. And Justine, I think you had some other things as well, didn't you?
Yes, I mean, you've alluded to it. It's a very multifactorial thing. I mean, the obvious thing is the hot flushes and sweats, which everyone's aware of and which will clearly disturb someone's sleep. But the drop in estrogen also causes an irritable bladder, as you say, so people then need to get up and wee more. But they're also of an age, often, the sandwich generation. There was that wonderful book Alison Pearson wrote. I can't remember what it was called, but it was essentially exactly that, describing that feeling of being squished in the middle with elderly parents to look after at one end and stroppy teenagers, also hormonal. So it's like a bath of hormones in some households, all trying to juggle for your attention. So I think a lot of women feel that sort of pressure as well, and that sort of then sort of spirals in that if you know that you've got an awful lot on your plate, and obviously at this age, obviously a lot of people are still working, so in addition to all the home life things, they've also got a job to do and to get through, and then start to get agitated in itself about not getting sleep. And I think we've had this conversation before, haven't we, Jessica, where there's this, we really, that if someone wants to take, a take home point from today, it would be there is no specific ideal length of time to sleep. It really varies. And I find that a lot of my patients say that their agitation in the fact that they're not getting 8 hours sleep is making them not sleep. Yes. So they're better off having.
There's no time that you need to sleep. All these magazines which tell you must sleep for 8 hours, or that who was it? Theresa May didn't sleep more than 4 hours. Well, it's fine. That worked for her, and she was able to function more or less. But there isn't, and everyone has their own rhythms, and so you have to do what works for you. And the other thing I wanted to add to what you said, Justine, was about relationships and your husband. We've got hormonal teenagers and we've got elderly parents who are very draining. But your partner may be working all hours or may not be working, and there's all these extra stresses at the time. And menopause comes at a very, very inconvenient time in one's life, I always think. but we have some solutions for you.
We do. And it actually is quite reassuring to know that what works for some isn't the same as for everyone, because I often see those 8 hours sleep. I should be getting this. I never get 8 hours sleep, but then I feel guilty because I can't get off. And I'm thinking, you know, this is absolutely dreadful for me. But menopause is a time that sleep can be elusive, and that is changing hormones, isn't it? Along with everything else.
It's in itself, I mean, there's two things. There's actually the changing hormones, and then there's the symptoms of the menopause, which cause the lack of sleep. So you're stimmy both ways, I'm afraid. But as we said, there are things we can suggest for you.
And that's very, very reassuring. So particularly because some of your ideas when we talked last, there are so many things that we can do to get a better night's sleep. So what are the options available to us?
Well, the obvious ones are what they call, again, sleep hygiene. So the really obvious one, make sure that your room is nice and dark, that there's not light coming in, or that your husband isn't reading in bed next to you and telling to go somewhere else. And there's not a lot of noise. I mean, if this is possible, that you can't hear something that's going on, your children on their computers. So sort of quiet, peaceful, no light. Make sure that you're wearing very comfortable, loose fitting pajamas. Some of these fancy little silk pajamas don't quite always, well, they look nice, but they're not the most comfortable always. And make sure you've got sort of comfortable bedding and the room is not too hot. So things, very basic things like that. And the other thing that is, don't drink too much before, fluid rather than alcohol to start with.
That's a whole other conversation.
Yes, which you can answer. So not too much fluid before you go to bed, because that's just going to exacerbate you needing to get up to go for a pee. Things like screen time. If you want to watch something relaxing, that's fine, but don't just do your emails and do your WhatsApps just before you hope to go to sleep, because your mind will be going round and round.
There is a, on the iPhone, there's a setting, isn't there, that you can put on your iPhone that changes it from blue light to a more yellow light, and you can set the time for that. So you can set it from like 10 p.m. to 6 a.m. or so. If you do look at your phone, as a going to sleep thing, then at least you haven't got glaring blue light, because that's definitely been shown to make a difference to impact on sleep quality.
Absolutely. And I know there are various apps that help you sleep, aren't there?
Oh, absolutely. I mean, I've tried a few of them. So, and the one of them that I would suggest is Headspace, which has both meditation and small chunks of meditation, 5 minutes, 10 minutes, which you can use whenever you like, even if you want to just have a relax or napping in the day. But there's much more longer ones specifically for sleep, which do a little bit of meditation and then talk you through, and they last for 45 minutes, but I guarantee you'll be asleep in about 10 or 15.
Thank you. I know that you've given us some recommendations for some apps, and when we write up the notes for this, we'll send those out to people. And something else that you sent, Dr. Jessica, was a pillow with a headphone in it. I'd never seen anything like that.
Yeah, well, if you have the problem that your husband is sensitive to noise and doesn't want to hear the relaxation tape that you find so useful, you can get either these pillows which have a headphone integrated so that it just comes softly into your ear, or you can get these funny sorts of headbands, which I think people wear in gyms so that people, they don't have to have hobby holding them or have pods in their ears, which transmit the sound directly to you. And I think these are very useful if you've got to think about someone else.
Thank you. I should probably ask anybody who's listening, have you tried these apps and do they work for you? Because so many people swear by them.
And the other thing I was going to say was that there's been lots of studies about music being useful, and this study went through music which had to be particularly slow, so 60 to 80 beats a minute if you're counting, and it has to be soothing and soft. And I was telling everyone before that someone has, a composer has actually composed some music which lasts 8.5 hours called Sleep, and which you can listen to and you can stream down, and apparently this is very helpful.
Thank you. And it's not just falling to sleep, is it? This is where the headphones come in handy, because sometimes during menopause you can be waking up at unusual times and needing to get back to sleep. But Justine, can I ask you, you mentioned that alcohol is a whole other story. What can you tell us about alcohol? Because we always hear of, I'll have a nightcap. Does that not work?
Well, the problem with alcohol is that it decreases the amount of restorative REM sleep, which is the sleep when we dream and we sort of sort things out. So often, as you know, you dream about things and it's actually vaguely related to something that's happened in the day. And it's kind of the body's way of processing things. So particularly when people have anxiety or depression or other things going on, they often, if they can get a decent night's sleep and sort of process some of that, they'll feel more rested. And with alcohol, you get a decreased amount of REM sleep. So you may sleep, but you may get to sleep. Certainly, that's what the nightcap is about. You have your nightcap, sure, you go to sleep, no problem. But then it's the wakefulness in the night. And I don't think it's just the menopause, although obviously alcohol vasodilates, so it dilates your blood vessels. So probably will increase sweats and flushes. So secondarily will cause problems, but it is also an age-related thing in that people don't metabolize alcohol as well. Well, we all, I mean, you know, I certainly definitely, thank God for my liver. I mean, I think it's very grateful that I can't drink quite as much as I did as a medical student, just as well. And you can't drink as much because you can't metabolize it. So it's also age. So we're of an age where we can't metabolize alcohol quite as efficiently, so it stays in your system longer and generally causes disturbed sleep. So people will either have a disturbed night's sleep or they'll be very wakeful, so they wake up, you know, 4 a.m, ping, you know, really big, and they can't go back to sleep. Then that's really difficult.
It also irritates your bladder. So
yes, exactly.
The bladder, so
increases the likelihood of getting up to pee as well. So yes, unfortunately, it's
a downward spiral, isn't it, that you can find yourself in. So cut it down or cut it out, or don't do it when it's an important meeting that's coming up and you know you're going to struggle to sleep anyway.
Yes, exactly. So if I know I've got a really hectic, busy day, the next day I won't drink anything. I won't even have one glass the night before. I just
concur with that.
Yes.
And the other thing I was thinking of was, apart from alcohol, which obviously you can think of as a drug, there are other medications that maybe you need to think about. Are you taking them? Over-the-counter medications sometimes, things like decongestants, which is stimulants. So if you tend to get a bit of sort of blocked nose or get you allergies, just don't use a decongestant before you go to sleep because they are stimulants. Very obviously not diuretics, anything that's going to increase your water flow because that's going to wake you up to go to bed, and as well as some antidepressants also are stimulants. So, you know, maybe have a word with your GP about which ones you're on, because there are some which help your sleep and would help your mood and anxiety as well. And obviously some recreational drugs will wake you up more than you'd like to.
Right, okay. So we often recommend people keep a diary of their symptoms. So I know I like a cup of coffee before I go to bed. So it doesn't affect us all in the same sort of way. But if you're keeping a track of your symptoms, you should be able to spot which ones it is that's a problem for you, and perhaps keep the gin and tonic till a Friday night if sleeping. So one of the other techniques you mentioned, because we've mentioned good hygiene, we've mentioned some of the apps that we can link to. And the other one that you mentioned before, Jessica, was CBT, cognitive behavioural therapy. And I know we have a lunch and learn coming up on CBT. So that can be very helpful too.
It can indeed. And there's more and more evidence among the menopause community, lots of trials, that CBT can be used for all sorts of other menopausal symptoms, and how very useful it is, not just anecdotally, but it's really been proved to do it. And there are not enough, I think, practitioners who do CBT who specialize in this, but a lot of them do have special sleep CBT, and it can be very, very useful. I haven't done it myself, so I can't tell you exactly what it is, but certainly to try and find out if your practitioner will do this for you. It just gives you tools. It gives you tools to help you. You lying in bed, you think, oh my goodness, I can't go to sleep. And it helps you dispel that and put you in a frame of mind that actually it doesn't matter if I don't go to sleep in the next 10 minutes, and to be able to deal with that. So,
okay. Thank you. Well, somebody's just said, can you tell us what CBT is, which is, of course, cognitive behavioural therapy. Now, this is, I think it's brain training, actually, to help you understand your thoughts, your actions, and to sort them. And we've got plenty of materials, and there's some free materials down to download on CBT, which are fabulous. So whether you're able to take HRT or other medications or not, it's a tool that is really, really helpful for everyone. And I think something that Justine mentioned to me last week that I think is helpful to everyone, particularly at this time, and that is good habits, you know, in terms of our schedule. Can you tell us more around that, please, Justine?
Well, a lot of the things that I generally advise my patients around this time, Mr. Panay, Nick Panay, calls it fit for 50. And I think that's a really good phrase to use, in that this is our midlife. And it's a point at, it's taking the time to think, okay, what am I doing well? What can I improve on? How can I remain, either get fitter and healthier or remain as fit and healthy through the next 50 years? Or however long, you know, just in that next stage of your life. So, and a lot of the things, the general advice I give will improve people's sleep without a doubt. The first example being trying to have a normal body mass index as near as you can. It is genuinely more difficult to lose weight and manage your weight in the menopause, but it can be done. And you should always try to do that, because people who are overweight, particularly with a BMI of over 30, so going into the obese category, will often have sleep apnea, diagnosed or undiagnosed, where they stop breathing for periods of time in the night, and their oxygen levels actually can drop quite precipitously low, and they end up with the very severe ones aren't supposed to drive, for instance, because they are so exhausted, they're at risk behind the wheel of a car, so at an extreme. But a lot of people, I think, have undiagnosed sleep apnea, so they may not necessarily snore, but they may not have a normal breathing pattern because they're overweight, and that causes pressure on the neck, and a big tummy puts pressure on your lungs, etc. So getting a normal weight will help you sleep. And then exercise, probably not best to, do sprints just before you go to bed. Obviously that would be stimulant, but early evening exercise. So going for a brisk, just a 20-minute walk, doesn't have to be, anything, that strenuous, but enough to just have some activity early evening and then relax afterwards. And then obviously things like yoga and Pilates, which are great strength exercises as well, but yoga before you went to sleep would be a useful way of relaxing. So those sort of general topics relate to sleep as well as just general well-being as a menopausal woman.
And having a routine, not staying in your dressing gown all day. I liked the thing that you were saying about pretending you're going off to work if you're working from home.
Yeah, I have a patient who is genuinely is walking to the station in the morning and then coming home again to start work at their desk in the spare room. But that means they're commuting, and then they do the same thing in the evening. And I often, my very sedentary patients, and a lot of people working from home at the moment are really, they just sort of roll out of bed, go onto their laptop and roll back into bed again. And getting them to, I said, just get ready for the day, pop your trainers on, walk for 10 minutes and back in the morning. At lunchtime, ditto. After you finish work, same again. And that way, if you do that, you've got an hour's worth of exercise without really thinking. And if you're listening to a podcast, it also helps de-stress. Funny, there are plenty of funny podcasts out. I mean, I laugh out loud sometimes listening to my podcast as I'm walking. I don't know what passers-by must think, but I literally giggle out loud to some of them. And it's a great de-stressor. And as you say, Deborah, it defines the day. So you've got a beginning, a middle and an end. So it's very relevant at the moment.
Even insofar as, getting up, putting some makeup on, if you're someone who wears makeup, sort of, doing your hair sort of so that if you have a Zoom meeting, you feel like you're actually in front of someone, and then taking off at the end of the day. So
routine's important.
Routine is very important.
Can I just ask you, because we've covered lots of ideas that anybody can do, whether they're taking HRT or they're not, and that's great. Can I ask about HRT? Because I can see there's a couple of questions, because you mentioned earlier, Jessica, that hot flushes can keep you awake at night, the nighttime version. Other sorts of menopausal symptoms can get in the way with sleep. And actually HRT itself can help you with sleep, can't it?
It can, absolutely. I mean, HRT, what the main point of HRT is to get rid of your symptoms, as well as all the other benefits it has. So if someone is symptomatic, not everyone is, then HRT will help, because what it does is stabilize, as I said, the estrogen level, so you're not going up and down, fluctuating. So taking HRT, and the right one for you, will definitely get rid of the night sweats and the hot flushes. It just does. It's the first thing that goes. Some of my patients say after a few days, it usually works within 2 weeks. And you just don't wake up because of your night sweats, because they stop. And the other thing is that there are different cocktails of HRT, but particularly one progesterone, which I'm sure many of your listeners will be on, which is the micronized progesterone Nutrigestan, to complement the estrogen, to protect your lining of your womb. That in itself, if you take it orally every night, is a sedative in its own right. So for women who have night sweats or flushes in the night, but they also have the sleep problems just associated with being menopausal, taking estrogen and the progesterone separately and using that micronized progesterone will also improve your sleep.
Ali, can you join us and tell us what the questions are on the chat, please?
Absolutely. Just kind of just touching on that point around progesterone. So someone said that they're finding that they're taking a progesterone in the evening, and they're actually struggling to wake up in the morning but if they take it too early, then they're falling asleep before it's time to go to bed. And just wanted any of your thoughts on what they might want to think about doing in that situation.
They can swap then. They're very clever little capsules, and they can be used, taken orally as a tablet, as Jessica said, or they can actually be used as a vaginal pessary. So if in that instance, I would probably advise they try swapping to using it as a vaginal pessary at night instead.
That's brilliant. Excellent. Okay, so someone's also asked, they're saying they really struggle with restless legs when they get into bed, which is really causing them to struggle to relax, to get to sleep at night, and just anything that you can recommend that they could be thinking about doing that could maybe help with that, because they said it's driving them absolutely insane to be able to try and get to sleep when their legs are just constantly moving.
There are medications you can take specifically for restless legs. That's not a particular menopausal thing. It happens to both men and women, and there are other medications that you can use if you really do have restless legs. But as far as I know, I don't think HRT will necessarily do that. But if you're sleeping better, it may be that you don't wake so much because of your restless legs.
And I anecdotally, this is not scientific, but anecdotally, my patients have found that if going back to that early evening exercise, that if they do some exercise in the early evening, their restless legs are often a bit better.
Okay, brilliant. And you talked about taking other medications and the impact on sleep. Someone asked about antihistamines in terms of whether that could have an impact and time of day and things around taking antihistamines if they are.
Well, antihistamines can be very useful for sleep. Most antihistamines that you take for hay fever or general allergies, make sure that they're the non-drowsy ones. So those are the ones you take in the morning, in the summer or early spring. But there are some antihistamines which are particularly good for sleep. Piriton is one, and there are others which some you can't buy over the counter. You might need to ask your GP or your doctor for them. But certainly Piriton, which you give your children when they have chicken pox or nasty eczema, you can certainly take that in the evening, and that is a fairly gentle way to get off to sleep. And it doesn't usually give you a hangover in the morning either. And Justine, you were talking before about melatonin.
Yeah, so melatonin, it is prescribable in a slow release form on the British National Formulary, which is like our sort of drug Bible that we prescribe from, but it's only licensed for over 55s, unfortunately. So that kind of, most of our menopausal women, by that stage, it's a bit late. But if you're in America or in Europe, well, basically everywhere apart from the UK, you can buy it over the counter. So I usually would recommend to patients, if they are somewhere, then to grab some when they're abroad. Although I have to say, within our menopause clinic at Hormone Health, we do prescribe melatonin. It's not a generalized NHS GP prescription, but off license, we prescribe it for our menopausal patients with great success. But it does vary, as Jessica says. So some people do feel a bit foggy, even with it's a tiny dose, but even with that, sometimes people can feel a bit hungover in the morning. So you have to be a little careful.
Yeah, play around with it. So take your first dose of the weekend when it doesn't matter if you get up, a little bit later. Same with the antihistamines. Take it try it at a time when you don't have to be on top form in the morning.
Yeah. Okay. And someone's talked about they're taking HRT, including localized estrogen, so they're managing their other symptoms, but they're still finding they're needing to get up in the night to go to the loo several times, and that's keeping them awake. Anything that you would to focus specifically on that as a challenge that someone may be facing?
Well, the whole of the urogenital area, so that includes your bladder, your urethra, and the vagina, and the vulva, the whole area is affected by a drop in estrogen. So often, systemic estrogen, so using a patch or a gel or even taking a tablet, will do quite a lot for that area. But sometimes you need specifically topical estrogen in that area, usually in the form of pessaries, vaginal pessaries. And that then helps replace the estrogen locally and calms the bladder. So they may well find their bladders less irritable if they have vaginal estrogen. And a year's worth of vaginal estrogen is the equivalent of one oral estrogen tablet. So it's really, really very, very low dose and very safe. And a lot of women suffer in silence with bladder symptoms and not realizing that even if they didn't want to take HRT, they may accept using something more locally.
Yes, absolutely.
Systemic, even those that have had breast cancer, for example, can use it without too much worry.
Yes, you can. I mean, you have to, sorry, Justine, you have to talk, you discuss it with your, if you've had breast cancer and you're still on treatment, discuss it with your breast cancer specialist, but a lot of them will be very happy for you to, it will also honestly help with more comfortable sex as well as bladder as well. So yes, very often you can take it on breast cancer treatment.
Thank you very much, Dr. Jessica. And I would say, I'm looking at some of the comments. Thank you to everybody who's told us that Calm and Headspace, for a large number of you, really does work. Hopefully you've picked up lots of other tips too. There's some questions about HRT, which we'll put some further information together when we send you this watch again, so that you can look at those specifically around the pros and cons of HRT. There's a comment in the box as well around, I feel guilty going and talking to my GP right now because of everything that's going on. We urge you, please do not suffer in silence. Do something about it. You can have a consultation. I know Hormone Health do consultations via Zoom and telephone call.
We do.
You do. And so there is every reason for you to be asking for help and support during this time. And I think we'll end it on something that might be getting a little bit old school for managing your sleep. And this was one that my gran always used to say, Ovaltine, cocoa, should we be having a glass before we go to bed?
Well, yeah, absolutely. Don't make it too big, otherwise it will affect your bladder. But there is actually chemically in hot milk. It does something to your serotonin levels, and it's really been used.
As does chocolate. So if you get so chocolate has tryptophan in it, which increases your serotonin, your feel-good hormone, and helps people sleep. So I would say, hot chocolate even better. Then you've got the milk and the chocolate.
Absolutely.
It certainly sounds good to me. So thank you very much, Dr. Jessica Setchell, Dr. Jessica Barron, and Sally Leach, of course, for answering the questions. And thank you very much, everyone, for joining us. We look forward to catching up again soon. Thank you.
Thank you very much for having us. Thank you.